This video, we're looking at a screening tool used by emergency rooms to determine if an x-ray is needed after an ankle sprain. But first, our disclaimer. Mike Matthews, physical therapist here with the PT411. Thanks for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com. So like I said, this week we're looking at a screening tool that emergency rooms use. It's called the Ottawa ankle and foot roll. They use this to determine if an x-ray is needed after an ankle sprain, after we roll our ankles. The reason why they use this is because ankle injuries, these ankle rolls, can be very, very common. And the problem is if every single person that rolls their ankle that goes to the emergency room ends up getting an x-ray, it ends up exposing them to a lot of unneeded, unnecessary radiation, because most of the time this actually isn't injured. But this week we're going to look at this screening tool that emergency rooms use to determine if they should escalate it and actually look at the x-ray or not. And the first thing that they look at is they'll ask you a question right after the injury happened, right after you rolled your ankle. Were you able to put weight on it right away? If the answer is no, they escalate it a little bit further. Then they will ask you, well, can you take 4 steps now? So they make you take 4 steps in the emergency room. So the first thing, could you put weight on it right afterwards? If the answer is no, they're probably going to take an x-ray, but they will first follow up, make sure that you still can't put weight on it. So about 20-30 minutes after the injury, if you still can't put weight on it, more specifically, if you can't take 4 full steps on it, then they're definitely going to get you into x-ray. If you can actually do both of those, they're going to look at the ankle a little bit closer. So we're going to look at my ankle here. First, we'll look on the medial side, the inside of the ankle. We have 2 bones we're looking at here. First, our medial malleolus, our ankle bone on the inside here that comes to a point. They're going to run their finger along this part of the bone right down here, and they're going to see if this is tender. If that's tender, probably going to do an x-ray. If not, they're going to run their finger up the back side up here along this edge, about 6 centimeters or so going up, see if that's tender as well. The next one that they're going to look at is this navicular right here. I know it's a little hard to see on camera here, but they're going to try to put pressure throughout here to see if this bone is tender or not, because what will end up happening sometimes if you roll your ankle going more outward, some of these tissues on the inside here can pull on that and cause an avulsion fracture of that navicular bone. Now we're going to look at the other side here as well. On the outside, the lateral side, we're going to look at our lateral malleolus first. We're going to see if it's tender down here, just like on our medial side, down at the point, and then also coming up about 6 centimeters up, excuse me, rather, on the outside over here. And then the last bone that they are going to look at here is your 5th metatarsal, the outside here, because you have your peroneal tendons of these peroneal muscles that come down and around over here. Sometimes whenever we roll that ankle more going inwards, it'll pull right there, cause an avulsion fracture out here. So that's the Ottawa ankle and foot roll. If we've rolled our ankle, it's looking pretty nasty, we go through the screening tool, and if we see that some of these are positive, we definitely need to go into the ER, because that's enough of an indication that the ER think it's important enough just actually take it a step further, x-ray you, and see if you have a fracture there. Now if not, if you just sprained it really bad, but this screening tool is coming back negative, it doesn't mean that it's not an injury or that it doesn't need extra care. We're going to devote the next several videos on just ankle sprains, so make sure you stay tuned. Again, I'm Mike Matthews with the PT411. Thanks for joining me.